Let's talk about heart block. With heart blocks, you want to pay attention to your PR interval, and we also want to pay attention to the relationship that our P wave has with our QRS. So our PR interval will be normally 0.12 to 0.20, and it should remain consistent along a normal sinus rhythm without a block. Now let's talk about first degree AV block. We're going to go ahead and look at our PR interval, and you're going to notice that our PR interval is going to be greater than 0.20. But every P wave is going to have a QRS complex, and it's going to remain consistent along the whole rhythm. Now let's talk about Mobitz type 1, going, gone, also known as Winky Bach. So what is happening here? Our PR interval is progressively getting longer, and we're going to drop a QRS complex. So what we're going to have here is 0.25 for this PR interval. Next is going to elongate to 0.35. Then we're going to have a dropped QRS complex. Now let's talk about Mobitz types 2. So in Mobitz type 2, what's happening here? Our PR interval is going to be consistent, but it's still going to be longer than 0.20, but it's going to randomly drop a QRS complex. And this is a progression from type 1, so we would want to notify the healthcare provider. So we'll have 0.26. 0.26 is going to remain consistent, but we're going to randomly drop a QRS complex, and this is going to be unpredictable. It's going to be no pattern. Now let's talk about our third degree heart block. This is fatal, also known as total heart block. Your healthcare provider must be notified for this rhythm. Now our P wave and our QRS complex are no longer communicating, so we do not have a PR interval. Your ventricle is beating on its own and your atrium is beating on its own with no rhythm. This will be a slow rhythm. So what should we do? We want to assess our patient. We want to check for medications to see if there's any medications that can cause this block. And we want to notify healthcare provider for any progression. If you notice your patient is going from a first degree AV block to Mobitz type 2, your healthcare provider should be notified. Now for your third degree heart block, since it is fatal, you will need transcutaneous pacing, and this patient will be sent down for a possible permanent pacemaker. And you want to remember your heart blocks are most likely going to be bradycardic rhythms, so you want to treat them as such.